Hey guys, Dr. Lovett, Lovett Family Chiropractic and Wellness Center. I want to take a minute just to talk about one of the most common causes of neck pain, which is a bulging or herniated disc. So I'll show you here on my model, we have two vertebrae in the neck, right, the bones, and then we have the disc that's in between. And that disc is important because it acts as a shock absorber. And you can see the nerve root that comes out right back here. And sometimes what will happen is, think of the disc like a jelly donut, right? We have the outer part, and then we have the inner part where the jelly is. Sometimes the outer part will get weak and the jelly will spill out of the disc and onto the nerve root, which I can promise you is not a fun situation. So I'll show you what that looks like here up close. And you can see when we put a lot of stress and pressure, especially on the front part of the spine or of the vertebrae, that disc will push out into that nerve root, and that's not going to be a lot of fun. It's been shown that it takes the weight of a dime to change how well a nerve functions. And you can imagine with simple activities like turning your head, bearing down like you're going to have a bowel movement, coughing, sneezing, or even just lifting your head up off a pillow can easily trigger an extreme amount of pain by pushing that disc onto the nerve root. Here in just a second, I'm going to show you how the spinal decompression machine works, how comfortable it is, how you're positioned, and how the table works. Here at our office, we have a couple of spinal decompression machines that work by creating negative pressure in the disc by pulling on the spine. Okay? Think of it like an accordion. When you pull the accordion apart, you're basically creating a negative pressure, creating a vacuum, and it pulls in air. This is doing the same thing to your neck, but instead of air, it's getting hydration and nutrition to the disc so that it can heal. Sometimes the pain will be localized in our neck. Sometimes it'll radiate up into our head. Sometimes down into our upper back or shoulders. Maybe even down into our arms, causing numbness, tingling, or weakness. Now, non-surgical spinal decompression is a safe and effective treatment for bulging and herniated discs, as well as degenerative disc disease, arthritis, pinched nerves, spondylolisthesis, and spinal stenosis. All right, so now we have Jackie set up on the cervical decompression, and we've tightened the neck piece around her neck. This strap just kind of holds her head in place so she's not moving around too much. The rope is hooked up to the headpiece, and the rope is attached to the computerized head up here, and we have specific protocols set in there. And what it does is it pulls for about 30 seconds, relaxes for about 10, and it does that off and on for about 12 minutes. It's a very specific protocol. The computerized head knows how much tension is actually in the rope, so it does a great job at pulling, decompressing that disc, taking pressure off the spine.